I'm Bill Nelson, Director of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins, and I'd like to welcome you to this year's 2022 Cancer Survivorship Conference. First of all, I'd like to thank the Harry J. Duffy family for their continued support of cancer survivorship in the Kimmel Cancer Center. It's been a long-standing commitment that has really begun to pay serious dividends. Over the past decade, or easily since the early 1990s, outcomes for people with cancer have continuously improved. We're detecting cancer earlier than ever before. We're treating it more effectively than ever before. And for that reason, we're generating more and more cancer survivors, more than 18 million at the last count. As we make these advances, we learn that cancer survivors have very special needs in healthcare, very special needs as they enter new lives and change the lives that they have, and special needs and interests of their families. The Kimmel Cancer Center is committed to helping cancer survivors and supporting cancer survivorship in just about any way we can, with advanced practice oncology social workers offering counseling and support, dedicated chaplains offering spiritual care and guidance, practical assistance and guidance from many people in the Duffy Family Services Group, and on-campus housing during treatment. We have a wonderful collection of speakers for today, and they're going to address many aspects of cancer survivorship, covering the mind, the body, and the spirit, thinking about emotions, about sleep, its quality and quantity, and about spiritual comfort. We know that you'll benefit greatly from this packed day, and thank you so much for joining us, and we look forward to seeing you.
Hello, I'm Tracy Orwig, oncology social worker, a member of the Harry J. Duffy Patient and Family Services Program. I join Dr. Nelson in welcoming you to our 10th annual Cancer Survivorship webinar, featuring 3 speakers on pertinent topics related to mind, body, and spirit. This program is offered to you through the generosity of the Harry J. Duffy family, for which we thank them. Some details about this virtual presentation. You may offer a question or comment through the Q&A button, although given the attendance, we may not be able to specifically answer each one. However, knowing our speakers, I'm confident that they'll do their best to address your questions. As you saw, our speakers do not have any financial disclosures, and we just wanted to again echo Dr. Nelson's wonderful remarks about the Harry J. Duffy Patient and Family Services Program. As a member of the department, just want to again share that we're here to assist you, here to support you. We help provide practical, emotional, and spiritual support to our patients, survivors, and caregivers, as well as helping with housing needs during treatment. So you can see there, you can visit our website or give us a call at 410-955-8934. And now, please help me welcome Dr. Jessica Engle, Assistant Professor of Physical Medicine and Rehabilitation. She completed a fellowship in cancer rehabilitation at the University of Texas MD Anderson Cancer Center. Dr. Engle aims to improve quality of life for cancer survivors in every way possible. Thank you, Dr. Engle, for sharing your time with us today and helping us to better understand the value of good sleep for survivors and their caregivers.
Hi, thank you very much for having me. My name is Jessica Engle, and I practice cancer rehabilitation. I'm part of the Department of Physical Medicine and Rehab. And because a lot of people don't know what physical medicine and rehab is, I just have this tiny little slide here. Unlike other medical specialties that focus on a cure, we look at maximizing improvements to patients' quality of life and improving independence. And we try to design a comprehensive program where patients and their family are at the center, and a big integral part of the members of the care team are a part of it as well. And we use cutting edge as well as time testing techniques to help patients that have cancer. And the patient with cancer is at the center, as are their family. And we work with all these different departments to try to maximize independence and maximize function. And you'll see we'll work with the oncologist, radiation oncologist, surgeons, et cetera. And we see patients throughout the oncology care continuum, and we try to maintain or restore function, reduce symptom burden, maximize independence, and improve quality of life. And this could be through different areas, as in rehabilitation as soon as someone's diagnosed, restorative, supportive, and even palliative rehabilitation. I'm one of the few fellowship trained cancer rehab physiatrists in the country, and I aim to diagnose and treat cancer-related impairments, including insomnia and fatigue, and use a patient-centered and goal-oriented rehab approach. And I see patients in Baltimore as well as in the National Capital Region. Being a cancer survivor, there's many unmet physical and psychological needs, as well as restrictions in activities of daily living, things like getting dressed, bathing, brushing your teeth, eating. There can be financial losses as well as relationship issues as well. And when looking at common symptoms in patients with cancer, we see fatigue is number one. It might even be 100% of folks will report fatigue. Insomnia is number two. Cognitive dysfunction is number three. Depression is number four, as well as then we have anorexia, pain, constipation, shortness of breath, nausea, dry mouth, numbness and tingling, and dizziness. And none of these exist in a vacuum. They're all altered by each other. So we have to try to treat all of them and get to the bottom of what's causing an issue. Insomnia is defined as trouble falling asleep, staying asleep, or getting good quality sleep. And this can be due to stress. That's what the typo is there for. And this can be due to stress. And many factors can influence sleep, including stress. So insomnia is trouble falling asleep, staying asleep, or getting good quality sleep. And so the National Comprehensive Cancer Network meets very often, and they did guidelines most recently in January of this year to look at sleep disorders. And they recommended using different, this is for survivors of cancer, and they recommended using various tools to look for sleep issues. And are you having a problem falling asleep, staying asleep, waking up too early, or with poor sleep quality? Are you experiencing excessive sleepiness, such as sleepiness or falling asleep in inappropriate situations, or sleeping more than during a 24-hour period than you have in the past? Have you been told that you snore frequently or stop breathing during sleep? And these are all indicators of poor sleep and or other issues that may be problems. Sometimes people need a sleep study, for example. They might have obstructive sleep apnea. And now for most patients, the sleep studies can actually be done at home. They're done remotely. They send all the instructions and information to your house. You hook it up, they make sure it's okay, and you complete the study, and then the information gets reviewed within a short period of time, and you'll know whether or not you have sleep apnea. And very rarely people have to go in as well. And then if there's concern for someone having a sleep disorder, we look at different comorbidities that could be an issue, such as alcohol use, obesity, respiratory issues, even some issues such as anemia could be impacting this. And then the big thing is emotional distress. Stress or anxiety can cause a lot of issues when we're trying to go to sleep. We're thinking about different things that might be bothering us, preventing us from going to sleep. Psychiatric disorder, some medications prevent us from going to sleep. And sometimes it's something as simple as meeting with a doctor such as myself who does cancer rehab, or someone that in palliative care, and looking at medications and maybe just changing the time when you take the medications. For example, steroids can be very helpful for a lot of things, but unfortunately, sometimes they can keep us up at night. And so trying to change the dosing times to have more of a space between when you take the steroids and when you try to go to sleep can really help you get some sleep. Sometimes hot flashes can wake patients up at night, and we have treatments for those, both lifestyle modifications as well as medications. Caffeine, of course, can interfere with sleep. Pain, fatigue are all barriers to sleep as well. Shift work can interfere with our sleep-wake cycle. And we ask how often this is occurring with patients, and if they might have some other issues going on, like sleep disorders such as obstructive sleep apnea, restless leg syndrome can be a barrier. And these are things that we look at. And we get some details as well. Are you taking a lot of naps during the day? Do you have poor quality of life? Is this causing distress? Sometimes then there's something also called circadian rhythm disorder, and that can affect people where you're not sleeping in the same pattern. It can be affected by things like shift work disorder. For example, if someone is working the third shift or the night shift or something like that, and not awake during typical hours that most of us are awake and most of us are asleep. And then there are many other issues that can affect sleep as well. And that can affect how our cognitive functioning. Sleep affects so many different things: our mood, our cognitive functioning, how much energy we have, our tolerance to pain sometimes, and many other things depending on how we sleep. Okay. And there are some tools to help sleep and fatigue. The bed is to be used only for sleep and for sex. That's number one. I know a lot of us have been using it lately with COVID and staying at home. A lot of us have been using it to, for example, to do work on, fold the laundry on, play, video games. But in reality, the bed is only supposed to be for sleep and for sex. And so if we use it just for those things, then our mind gets used to using it just for sleep and for sex. And the bed is a place to sleep, not a place to do work, not a place to fold laundry, not a place to, play video games. Sometimes people need a nutrition consultation because maybe they're not getting optimized nutrition. Maybe they're hungry at night and that's what's keeping them awake. There is also something called bright white light therapy. Say that 3 times fast. And it's done for 30 to 90 minutes in the morning, in the early mornings at 10,000 lux. And some people have these light boxes. Another good thing to do is just when it's sunny outside, when it's the daylight, open up the shades, let the light come in. If it's a dreary day like we had yesterday, turn on the lights in the morning and keep them on throughout the day and make it dark at night to try to replicate your body's normal cycle. Sometimes massage therapy, yoga, acupuncture can be very helpful in people getting a good night's sleep. Sleep hygiene is super, super important. You have to wind down before you go to bed. You don't want to do anything that's stressful, watch an action movie, excuse me, watch an action movie or do strenuous exercise or anything like that before you go to sleep. And getting into a routine can be very helpful. Avoiding long naps can be helpful as well because that can throw off your sleep cycle. And then avoid certain activities close to bedtime that are stressful, or even maybe talking to someone stressful on the phone or doing a stressful activity. There are medications, there are supplements that can help for sleep. Even something as simple as melatonin available in many drugstores, internet, and pharmacies, as well as grocery stores can be helpful for some people. I think that it's important to start very low on those supplements like melatonin, such as like 1 milligram, and then slowly work up. I wouldn't take more than 10 milligrams. And lifestyle interventions can be very helpful. Exercise is super helpful for sleep and fatigue. Okay. And that's why I have this slide here from the Moving Through Cancer initiative, Exercise for People Living with and Beyond Cancer. The American College of Sports Medicine in 2019 got together and released 3 fabulous papers. And they're saying to avoid inactivity, moving more and sitting less benefits nearly everyone. So the less you sit, the better. The more you move, the better. I probably should be standing for this lecture right now. And this was from the American College of Sports Medicine, and it's for patients that have cancer or cancer survivors. And for overall health, they want to recommend moderate aerobic exercise. What that means is you're doing aerobic exercises, you're moving, you're sweating, you're breathing a little bit harder. You can talk to the person next to you, but you can't sing. The CDC says you can talk but not sing. Or vigorous aerobic exercise, it's a little harder to talk, at least 75 to 150 minutes a week. Again, moderate aerobic exercise, at least 150 to 300 minutes a week, or a combination of both those things. Any movement is good movement, parking the car farther away, using the stairs instead of the elevator, anything like that, even if you're waiting online, trying to balance on one foot if you're able. And they also want you to do resistance exercises. Those are very important as well. And they also found that exercise can help with cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, sleep, lymphedema, and bone health. And most of those things, fatigue, health-related quality of life, physical function, anxiety, depression, all influence sleep as well. So they don't occur in a vacuum, and they can all be very helpful. It can also help lymphedema and bone health, which are added bonuses. Again, I want to drill this down. Aerobic exercise 3 times a week in 30 to 60-minute clips, although anything you do helps, and this can help sleep. Resistance exercises 2 times a week, 2 sets, 8 to 15 reps at a time, can also help many symptoms. Aerobic exercise and resistance exercise are best, and they can help many symptoms that we experience with cancer. Okay, and again, this is from the exercise consensus guidelines that came out in 2019. And there also is a thought that there are many things that go into influencing a cancer occurrence, but they might prevent or even lower the risk exercise might prevent or lower the risk of colon cancer, stomach cancer, esophageal cancer, bladder cancer, kidney cancer, endometrial and breast cancer, and probably more. And it likely does this by decreasing inflammation and many more things. And it decreases fatigue, anxiety, and depression. Exercise decreases fatigue, anxiety, and depression, improves physical function and quality of life, and does not exacerbate lymphedema. For cancer survivors, incorporating exercise to improve survival after diagnosis. After diagnosis is most important in breast, colon, and prostate cancer, but might be important in more cancers that we just don't have the data on yet and haven't studied. Okay, and then and exercise is a modifiable behavioral risk factor. Again, it could have some prevention with colon, breast, bladder, kidney, stomach, esophageal, and endometrial cancer. We want to decrease sedentary activity, lower the risk of colon, endometrial, and lung cancers, and probably more, and improve survival from exercising before and after a cancer diagnosis. In 2022, again, the NCCN came up with these fatigue guidelines as well, and they defined fatigue as a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer treatment that is not proportional to recent activity and interferes with usual functioning. And you know, you get sleep and it doesn't help. So some people will say, I feel like I'm already tired tomorrow. Fatigue is underdiagnosed, underreported, undertreated, and it might even be in 100% of patients, but it was listed as the #1 symptom in that study I showed you earlier. It's a very, very common symptom. It may persist months to years after treatment, and it alters quality of life and causes distress. We all hear, what level is your pain? What level is your pain? We say, oh, it's, on a scale of 1 to 10 or 0 to 10. And okay, well, we have these different medications. These are available in the pharmacy to treat that. This is available over the counter. This is what you can do to treat that. There's an injection to treat this. We don't have the same arsenal or that we talk about fatigue with. We don't talk about fatigue as often. We don't talk about sleep as often, and it can be extremely distressing for people. So one strategy you can use is energy conservation, where you can pace yourself. Those dishes in that little stack over there, they're going to stay there, I promise you. You don't have to do it all in one day. You can break up activities. You can sit in a chair. You can break up chores into small intervals. Do activities that require more energy when you have more energy. People tend to have more energy at a certain time of day, hopefully, and or a certain day of the week after chemo, for example. And so you might want to try to do those activities on those days. And you can try different ergonomic techniques, like putting things in a cart instead of carrying them. Even things as simple as getting something. Sometimes people really benefit from things like a rollator or one of those walkers that has a seat in it and a little basket in it, because then you can sit down, and it might give people access to things they're not able to otherwise have access to and participate in. You could spread activities out over the week, do a little and rest a little bit. Consider the energy costs and time to recuperate. And then sometimes assistive devices are very helpful as well, such as this little sock aid I'm showing here, to put on a sock instead of getting a sock and trying to bunch it up and bend over. It could be uncomfortable, and it uses more energy. And occupational therapy are great friends, and occupational therapy are very helpful with this as well. And I recommend planning, prioritizing, and pacing, because you have an energy bank for most people, and it only allows you to have so much energy in a day. I do sometimes ask people this fatigue scale. 0 is no fatigue. You feel like you can go out and play in a recreational game, and 10 is the most fatigue ever. You feel like you can fall asleep almost standing up, is usually the comparison I give. But there's different levels of fatigue along the way. And that can vary from day to day. It can vary from time of day. Sometimes it comes in waves we're seeing as well. And the biggest strategy is physical activity. Maintain activity level or initiate exercise program. If you're not exercising, now is the time to start. That can help your sleep. It can help stress, many other things that can help fatigue as well. And then also monitoring your own fatigue level. Sometimes we recommend distractions to prevent really seeing how much is really bothering you. If you're distracting yourself by, puppies, and if you like dogs, or animals, if you like the animals, or seeing family, friends, even different electronic platforms are very helpful. Socializing, games, make your interactions meaningful. structured daily routines are very helpful. Sometimes you have that opportunity to sleep in, and that can really throw off your sleep-wake cycle. If you could try to get up at the same time every day as well, that can be very helpful, and set priorities. You should have realistic expectations, pace yourself. Helpful reminders are great. You can use the phone or different technologies as well to kind of to help you. Do one thing at a time. Again, they're ergonomic and assistive devices. Limit naps, don't overdo it. Delegate when you can. Complete the activities when you have the most energy, postpone those non-essentials, and use technology to your advantage. And going outside is really helpful as well. Getting the fresh air, being outside when there's sunlight, making it dark in your home when there is, it's nighttime is helpful as well. And try to limit screen time before bed is helpful. Additional tools that we have in our toolbox, again, oh, look, it's exercise and physical activity. Cardiovascular and weightlifting programs, rehab referrals are very helpful. I'm a big proponent of working with my colleagues in physical, occupational, speech therapy, pelvic floor therapy, aquatic therapy, vocational rehab, and all the other great members of the team. Sometimes people benefit from psychosocial interventions, support groups, journaling, and mindfulness. And I think I'm on the time limit. Thank you very much. I appreciate this. And if anyone has any questions, I'll be here at the end.
Thank you, Dr. Engle, for that insightful talk. We look forward to seeing you at the end as part of our panel. My name is Moira Bucciarelli. I am a chaplain for the Kimmel Cancer Center and a member of the Duffy Family Patient and Family Services team. I am pleased to introduce Mr. Wayman Scott, who's the Associate Director of Diversity, Equity, Inclusion, and Community Relations for Gilchrist GBMC Healthcare. Wayman is a native of Maryland and a graduate of both Towson University, Loyola University, and Washington Theological Union. He has served as a youth minister, a grief counselor, hospice chaplain, and as a sculptor as well. Thank you, Wayman, for speaking to us about hope, resilience, and the spiritual life.
Moira, thank you so much for having me today, and I'm very glad to spend time with you and the people on this call. So we're going to spend time this afternoon focusing on a few core things. Number one, what is spirituality and why is it diverse? Number two, how do we cope with some of the changes that we face as we move through a cancer diagnosis? And then what are some of the everyday, number three, mindfulness techniques that can help us connect to the present? I don't have slides because you will need to see my hands because we're going to be practicing some mindfulness techniques together. So you're going to get some in-the-moment homework with me here. So who, right? Who does this affect, right? A cancer diagnosis can impact not only the patient, but also the family, the friends, the caregivers. And it's a distressing experience when people feel that their emotional, psychological, physical, spiritual well-being is called into questions. There's going to be feelings of distress. And what happens, people often use and often turn to religion or spirituality as a way to cope. And some people who are living with cancer could have feelings of fear. They could have feelings of anxiety, sadness, loneliness, even being cut off. And these symptoms and these feelings can be in addition to some of the physical symptoms that they might have. So who does the cancer diagnosis affect? Well, in addition to the patient, it is the family, it's the found family, it's the caregivers, it's all those that are close to the individual affected. And together, they have to find and chart a new way forward as they discover really what it means to survive. So you might have heard me say a minute ago, spirituality is diverse, right? Spirituality is something that is deeply personal, and it's a diverse expression of the sacred. I want to offer a definition from Brene Brown. So she defines spirituality as recognizing and celebrating that with which we are all inextricably connected to. We're connected to each other by a power greater than all of us, and that our connection to that power and to one another is grounded in love and compassion. Practicing spirituality brings a sense of perspective, meaning, and purpose to our lives. Perspective, meaning, purpose. And I like to say that it's unique to people's journey, right? It's unique to finding meaning in life, exploring sources of peace, sources of strength. People find that meaning and strength in different ways. So when we talk about spirituality and those elements, some people might find, or during a time of crisis or diagnosis, might return to the faith where they came from, or a faith that they grew up in, right? Some people, it could be about a religious tradition or drawing on their religious faith or spirituality. Spirituality for some, it could mean connecting to nature, right? And for some people, it could mean other elements like yoga, connecting to your body, mindfulness, art, music. Some people find connecting to the sacred, connecting to your spirituality means pouring in more time to your family, to your found family, to your friends. Even people with similar practices, they can experience it differently. Spirituality is that diverse. So you could worship at the same synagogue. You could do the same meditation. Go to the same mosque or church, hear the same sermon, hear the same scripture, and you will experience it in a unique way because we're unique beings. And we are not only physical beings, but we are emotional, we are spiritual, right? So we're all of this complexity put into one, and somehow we find meaning, we find ways that allow us to transcend and allow us to connect with something that is meaningful and valuable and life-giving and fruitful to us. But what about when that is called into question, right? We're not talking about strictly a physical impact, right? Yes, we're physical and we're emotional, but surviving cancer doesn't mean that the impact is strictly on the physicality and physiology of our bodies. There are non-medical losses that you might go through when you have to cope because of a medical diagnosis and because of physical symptoms. So I want to ask you listening, what have you had to let go of? Have you had to let go of it? What have you had to change? What new things have you started or developed? And what does it look like to you if you love to run? If running in nature was how you connected with the sacred? But as a survivor, what if you can't do what you once did? What if you're not able to run in nature the way you once did? What does it look like if you had a career that left you feeling meaningful? You felt meaningful about the work that you did, so much so that it was part of your identity. But because you're moving through this diagnosis, you might not be able to have that life-giving, meaningful career anymore. What does that look like? Right? What does it look like if you had a financial freedom to travel? You had the physical ability to go, and a loved one or somebody special to go with. But now one or all of those things have changed or have been called into question. Now, why am I talking about these, right? We're supposed to be talking about spirituality, hope, resilience. How can hope be found in situations like these? Well, hope can be found in the fact that we're not static beings. And when what is meaningful changes, we have to find new ways of meaning. So you might not have the finances or the health you once did to travel with that loved one. But where is our resilience, right? Can you or that loved one find a way to spend special time together without travel, right? If you loved that career of being a teacher, but you're unable to teach full time, right? Can you look at what you can do? Does that look like a couple of hours a week tutoring students at a community center or even virtually, right? Hope can be found in the reality that we can still connect with what is meaningful, right? And connect with what is sacred. We are not static beings, right? And I want to talk about just a couple of spiritual interventions, and then we are going to engage in a couple of mindfulness practices. So when I say spiritual, some people define that as, okay, well, he's saying spiritual. He's going to preach to me. This is going to be about religion. This is going to be about a dogma. Like I said, it's unique to an individual. And some people, spirituality does mean something that is faith-based or rooted in an organized religion. For some people, it doesn't, right? And that's how diverse spirituality is. So we have to look at our interventions with diversity as well. So you're charting a new path forward. It's not easy to do that. So we want to be able to focus on the now, right? How do we not get distracted by 100 other things? How do we not get distracted by asking, well, what if, right? And going over different scenarios. How can we explore our new reality in the moment? Mindfulness, right? Mindfulness is a way to do that. It engages us in the moment. It can engage multiple senses to focus on, bring you back to the present. So we're going to spend a couple of moments doing some mindfulness techniques that can draw us into the present. Some of the other benefits of this is that it could help mitigate some feelings of anxiety. It could help us focus. It could help us ground ourselves. Some people find that in exercises, activities like yoga. Some people use mindfulness practice through meditation as they're putting together their day. I like to invite people to focus on and accept some of the victories that you have, right? So every day there might be a victory, or every week, and no victory is too big, or no victory is too small, but you can take moments to celebrate. Also, prayer is another way, especially for those that experience spirituality through a religious context. Prayer is a way, and some people use music to pray, right? Music, there's even music therapy that can put you into a different state that is more meditative. So meditation, yoga, nature, music, these are all various things that we can use to connect us to the moment, to connect us to each other, connect to ourselves, connecting to nature, and connecting to the sacred. So we're going to go over just a few interventions. I think I'm still doing okay on time. I think so. Okay, cool. I got the thumbs up. So we are going to look at a wake up exercise. So when you wake up in the morning, right, I want you to focus on 3 long, deep breaths. Breathe in through your nose, breathe out through your mouth. Find a rhythm as you do that. Notice your chest is rising. Notice your chest is falling. Center yourself in that waking moment. And then ask yourself, what is my hope for today? What is my hope for today? And use these prompts. I hope I might show up today and have the best impact. How am I going to have the best impact when I show up today? What quality of mind do I want to strengthen and develop today? So what do I need to do to take better care of myself? And during these moments, during difficult moments, how do I hope to be compassionate to myself? And how do I hope to be more fulfilled today? And think about those questions. And then at some point in the day, I ask that you take a moment to check in with yourself. Take a deep breath, right? Find a way to be mindful in the moment. That could mean prayer. That could mean a mantra. That could mean listening to that song that's going to put you in a more positive state. But these are all elements of self-care. And I want to show you one technique called 5-fingered breathing. Now, when you think about yoga or doing art or engaging in some element. Sometimes that's not always accessible right there in the moment. 5-finger breathing is a way to connect right there in the moment. So hold up your hand, right? See my hand, hold it up. So take your index finger on your other hand, put it at the bottom of your hand. And as you bring it up to your thumb, you're going to feel the sensation of your index finger along the skin. As you do that, I want you to breathe in slowly. Hold it, come down, breathe out slowly. And then again with your index finger, move it up and make sure you're actually touching it. Don't do it with the air. Do it actually finger against finger. Breathe in, hold it, exhale, and breathe out. Your middle finger, same thing. Breathe in, hold it. 1, 2, 3, 4, 5. Come down, breathe out. Ring finger, breathe in, hold it, breathe out. Pinky finger, breathe in, hold it. 5, 4, 3, 2, 1. Breathe out. What does the texture feel like on your fingers, right? Were your fingers dry? Were they moist with sweat? Were they shaking? Think about what placed you in the moment. Could you feel the breath coming up and down on your chest? So one last thing before I get ready to close my part, I want you to try 5, 4, 3, 2, 1. And this is something that you can do right now in the moment, right? And this is a way to center you right now in the moment. So I want you to look at 5 things that you see. This will engage all of your senses and different parts of your brain. So by the time you're finished with this, if you were in an aroused or anxious state, it can take you from there to another place. No one technique works for everybody, but these are potential tools in your toolbox. So 5 things you see. I see my pen. I see my computer mouse. I see a page of notes. I see a window. And I see my own image on the screen. So that's the easiest. 5 things you see. And then I want you to think about 4 things that you can touch. And I want you to do more than think about it. I want you to actually touch them. I want you to say, okay, I see my computer mouse. I'm going to touch it. I can touch it. I feel it, the surface of it in my hand. It's smooth. I'm touching my leather phone case. I feel the grooves in it, the bumps in it, underneath my fingertips. I feel the hardness of the table. It's cold, right? It's smooth. I feel my pen. I have to touch it with all my fingers so it doesn't slip out, right? So I hope you're doing that where you are. Think about 3 things that you can hear. Now, people think, well, hold on now, I can't. I'm hearing you in the conversation. Take a moment just to kind of pause. Sometimes people hear traffic outside or a helicopter or the hum of an air conditioner or refrigerator. But just think for a moment about what you can hear. 3 things. It's harder as we go along. 2 things you can smell, right? Do you smell the hand sanitizer that you just used? Do you smell the coffee that you've prepared? Do you smell someone's cologne or perfume at the desk next to yours? Right? Just think about 2 things that you can smell. And then lastly, 1 thing that you can taste. So maybe it's the last meal you had. Maybe it's a breath mint. Maybe it's your toothpaste from this morning, right? But what taste do you still have in your mouth? And you're really looking and focusing on, what's on your tongue. What essence are you feeling? So 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. So these are a couple of techniques to keep you grounded in the moment. And oftentimes when we're grounded, we can better connect with the sacred. We can better connect with what is meaningful and engage that. Thank you.
Thank you, Mr. Scott. We will welcome you back in a few minutes for our session of Q&A. I'm Chelsea Johnson, an oncology social worker and member of the Harry J. Duffy Patient and Family Services Program. I am pleased to welcome and introduce my colleague in the Cancer Center, Laura Hoofing. She is our Psychiatric Nurse Liaison who works primarily in the outpatient setting with our patients. She has been a nurse for over 42 years, beginning as a bedside nurse in oncology. After earning a graduate degree from the University of Cincinnati as a clinical nurse specialist in psychiatric nursing and mental health, she began her present work. We look forward to hearing her insights about coping well in the midst of uncertainty.
I'm so happy to be here with all of you today. I want to thank my colleagues for including me into this very important webinar. And I feel very honored with to be present with the other speakers who actually have touched on a lot of things that I'm going to touch a little bit on, but they did a wonderful job. So that's made my things for me a little bit easier. I want to talk a little bit about what it means to cope with uncertainty coping in the midst of uncertainty, and certainly a cancer diagnosis makes that incredibly a situation that's very difficult. When I became an oncology nurse 42 years ago, everyone told me that the hardest thing they were dealing with when they were told these three words, "You have cancer," that uncertainty was by far the hardest thing they faced. I was out of oncology for about 20 years, actually about 10 years, and came back to oncology 22 years ago as the psychiatric nurse for oncology, and people were still telling me how hard the uncertainty of living with cancer, having that diagnosis, was the hardest thing that they faced. And so we're going to talk today about how one may find some helpful ways to deal with the anxiety and also the absolute distress that can happen when you get that diagnosis. And as we well know, distress can feel like many things: fear, anger, uncertainty, a lack and loss of control, hopelessness, anxiety, depression, sadness and despair, sorrow and grief, numbness, disbelief, and many, many other things that you all could add to that. One of the things that I wanted to touch just a minute on is because often as a psychiatric nurse, I'm often asked to say, if someone's depressed or having anxiety. But there is a normal response to depression or to uncertainty and to distress that oftentimes we don't talk about. And it's called demoralization. And I often see a lot of people, especially when they're first diagnosed or they are having a lot of medical or physical symptoms or changes, or they get upsetting news, that they actually have an emotional response to that. And you can look at these things and you think, well, gosh, Laura, that sounds a lot like depression. People will oftentimes feel very disheartened, discouraged. They may feel hopeless and stuff. But the difference between this and what you're looking at when you're looking at possibly a major depressive disorder, depression, or anxiety, is that they're often related to a specific situation. And one of the things that I always tell people is when you're trying to deal with distress or something that oftentimes makes it very hard to deal with uncertainty and stuff, is if you're having a lot of untreated medical symptoms. And so if you are having pain, or if you're having the fatigue, you're having a lot of nausea and that sort of, always make sure that you go and you get your medical people to make sure that they're managing your symptoms. They will, anytime that someone does not feel well, it will always aggravate their distress that they're experiencing. So please make sure you do that. Usually what happens with demoralization, as people feel better, as they adjust to the change, the news, oftentimes their mood and anxiety will improve. Unlike with a depression or maybe unmanaged anxiety, you may continue to have those symptoms even if you're feeling better. So let's talk about, how do we manage distress and uncertainty? How do we cope with uncertainty? And I have to be honest with you, I've been a nurse for a long, long time. I tease people sometimes and tell them I started when I was 5. That's why I still look so young, but I've been a nurse for 42 years. But obviously I was a little older than that. And one of the things that I have been very lucky to is my patients, as I've never had cancer, have helped me. Their loved ones have helped me to sort of say, how do we get through this? And so these are things that I have learned mostly from patients and their families who have gone through this. And so how do they live with uncertainty? How do you live with the loss of control or the not knowing? And what so much of the time people have, patients, family members have told me, what really helps them is to focus what they actually do have control of, or what they know is certain in their life. So instead of the what is, it is what is, or what's possible. Because there's so many changes that happen with cancer diagnosis and all the treatments and the medications and all that stuff. Again, focusing on what do I actually have control of? What do I know? I know I am certain that my family loves me. They will be there to support me. I am certain of my faith or whatever it is. And so if I can, in the middle of thinking like, I feel out of control, I don't know something, I'm uncertain. If you take a step back and can say, this is what I know is certain. This is what I know I have control over, can often cause a great decrease in the distress that someone can have with that. I know it's kind of a cliche to say one day at a time, but oftentimes when people are looking at cancer and they start to think about, well, how much time I have or what's going to happen in this period of time, that again, taking it one day, taking it a couple days, because it's too overwhelming to be thinking about months, years later. And as Wayman said, that idea of staying in the moment and being present is so important. Oftentimes, you know, especially my patients who have some kind of position where they're long-term planners, or people, sometimes people say, you know, hey, Laura, I live in the future too. I'm always planning things. Really just setting some short-term realistic goals and plans can help sometimes people to feel like, okay, this is what I'm certain of. You know, I can go to my grandson's game tomorrow, or I'm going to look towards going on vacation in a month versus what I might be doing in 6 months. Oftentimes people feel that is so helpful because it gives them something to look forward to. And it also feels more manageable than trying to manage what might happen in the future. Also, gratitude. There's actually been some really nice studies done that when people, there was a study done where people for a month, or no, actually a week, sat down and wrote down 3 things they had gratitude for. And before they had done that, they had measured their quality of life. And suddenly what they did after they told them to stop doing it, they noticed though that the quality of life continued for up to a month later, because people began to take some time to recognize what they found they were grateful for, that they were thankful for, that they had gratitude for. It also made people start to look at the good things in their life and not just focus on what wasn't good or what they weren't certain about. Also, mindfulness. Wayman just did those wonderful exercises with us about being present in the moment, mindfulness, but being mindful of actually your thoughts and your attitudes. You know, one of the things that one of my patients have often told me is sometimes, you know, they want to have a positive attitude, they want to feel good, they want to have positive thoughts, but sometimes they can feel sort of burdened by that. And the fact, especially if they expect themselves to feel that way all the time. I had a young man one time, he was in his 40s, who had, unfortunately, a very bad cancer. And he was told constantly, if he just had positive thoughts, he had a positive attitude, he had a great outlook, he would beat this cancer. Well, unfortunately, his cancer wasn't listening to that. And his cancer was not getting better. And he actually developed feeling suicidal with the plan because he felt like he was letting everybody down. And so when I told him, I said, you know, that's not humanly possible, especially when you're not feeling well or things are difficult, to always have these positive thoughts and attitude. He was greatly relieved to hear that that was not an expectation that he should be putting on himself. And it really is important to manage those expectations. We, however, know that people, when they have more positive thoughts, we also know that our thoughts often affect our feelings. There's a type of therapy called cognitive behavioral therapy, and the whole purpose of that is to help people look at their thoughts, because our thoughts affect the way we feel. And so allowing oneself to be able to be mindful of thoughts and how to have those maybe be more positive, or to be able to recognize when they're struggling with thoughts and attitudes, to have and maybe adjust those things to be in a positive way without expecting themselves to always be positive or have positive. You know, one of the things that's so important is to be really kind to yourself. Often my patients spend a lot of times beating themselves up. I'm not doing this well enough. I should be doing better. I often say to them, well, how would you respond to a friend? Would you have these expectations? Would you be less kind to, would you be more kind to a friend that you're actually being to yourself right now? And also deal with being realistic about what you expect of yourself. Oftentimes people set these very unrealistic expectations, or they expect themselves to be able to be the same as they were before this diagnosis, before treatment, before things happen. And they set themselves up. And that increases then that feeling of not having control, being uncertain. And, you know, Dr. Jessica Engle talked a lot about fatigue. Don't underestimate how the level of fatigue doesn't affect your ability to be able to do things and be kind to yourself. So again, be very realistic about what you can and cannot do. Honor your feelings. I had this incredibly wonderful patient who was an old psychiatric nurse. She was in her 70s, had stage 4 breast cancer. Her and I bonded. I was doing a group for women who had metastatic cancer, and she was a very no nonsense kind of person. You knew what she thought. And she seemed to always have answers. And in fact, one of the younger women in the group said to her one day, you just seem to know. You just seem to know, because we had come back from Christmas break or from the holidays. And she asked the group, who in this group has bought their Christmas card, Hanukkah cards, whatever cards you send out for the holidays? Because I have. And I bought them for this coming year, because I figure if I'm here, I'll use them. If I'm not, somebody else can. And so she just seemed to always be very, like, just right on top of everything. And when the young woman asked her, said, you know, Carol, how do you do that? And she said, let me tell you something. Every morning, when I wake up in the morning, I allow myself to lie in bed for about 30 minutes. I pray, but I take time to check in. I take time to honor how I'm feeling, whether it's positive or negative, but I allow myself the luxury of being in that moment and honoring how I feel. And then what I say to myself is, okay, now you have the rest of the day. I want you to get up and I want you to live this day as best you can. But I think often sometimes people tell me, I'm afraid of feelings. What if I start feeling a certain way? Then I might have, but it's very important. Your feelings will come and they will be there, but to take that time to honor them can be incredibly helpful. I think one of the best things that patients have shared with me and stuff is talking about how they adapt sometimes and reclaim things, because they will say to me, cancer has taken so many things from me, my energy, possibly my future, it's changed my life forever. It's taken away physical things in my body. And, you know, how do I not let it take more away from me? It should, but how do I adapt to all these new changes? How do I reclaim some of the things that I might have lost? And, you know, change is hard no matter when we have to change. Even if we make a decide, oh, I'm going to lose some weight, or I'm going to get in bed earlier or whatever. But when it's unexpected and it is life-changing, it can be extremely difficult. We also are creatures of habit. We tend to get very stuck in the way we think about things. And one of the things I hear people talk a lot about is, well, this is the way I used to do it. And they are so about, well, this is the way I do things, that they forget to maybe actively challenge themselves to say, well, if I can't do those things like I used to, are there ways that I could still do things? I tell people, I encourage people to think outside the box, to be creative. I had a patient once who, it was getting near the Christmas holidays, and she was the one in the family who always did Christmas, and she did Christmas very big. house was beautiful. She did all the cooking. She did the beautiful presents, and she did this for her family and her friends. And unfortunately, because of her treatments and her cancer, she just didn't have the energy. She wasn't able to have the ability to do these things, and she was grieving, which of course, part of this is there is grief and loss, and recognizing that and allowing oneself to grieve is also important. And we started talking about how could Christmas be different? And she said, well, I've decided that my children have decided that they're going to bring Christmas, and they're going to do Christmas this year. And she said, I decided that I've got enough energy to do a couple of the favorite dishes, but they're going to do everything else. And we talked about what a wonderful thing that was for her to be allowed her children to express how they wanted to do Christmas, bring in the traditions that she had made so beautiful in their family, but to offer new ways that they might find ways as family to enjoy that Christmas. And we talked about what a wonderful legacy she had given to her kids, that they could have these wonderful, wonderful holidays. I had a patient recently also who told me that he can no longer physically do work, but he has his own company. And he has allowed his son said, I'm really interested in this, what you do, and getting into this business. And now he's allowing his son to be able to start, but because of technology, he can actually be present when his son is there. They have a business where they do plants within businesses. They bring in different plants and things and manage the plants. And now his son has developed this whole new career, this whole new thing, but his dad is still a part of that and is still in charge. So again, I would encourage, how do you take back things that you can? Certainly, how do you grieve and things that your losses, but can you adapt? Can you adjust things to where, and then celebrate, even if you can't do it as well or the same, can you still allow yourself to celebrate what you've had? Finding meaning, Wayman talked a lot. I'm going to talk a little bit about finding meaning, finding hope. Oftentimes finding meaning helps us to figure out, how does this make sense? And I love this quote from Joseph Campbell, because he said, life is without meaning. You bring that meaning to it. You ascribe to it. And so finding that meaning for yourself in the situation of having a cancer diagnosis and survivorship is very important. And each of the people in your lives will find that meaning also. And trying to make sense. And how to, one person that I knew said, he was a physician. And he said, getting cancer was one of the most best things that ever happened to me, because I spent so much time being a doctor, being in my career, putting so much value in those sort of things, that actually getting cancer helped me find meaning in other aspects of my life that I had ignored, that I was able to reconnect and connect with family and friends and parts of myself that I had never been able to do before, because the meaning of my life was so much about being a physician. So again, exploring those things. Also, meaning will change. Oftentimes, with hope will change throughout your diagnosis and then survivorship, and allowing yourself to be open to looking at those new meanings, can be a very good way of also dealing with uncertainty. And again, finding hope. I love this. Hope is being able to see light despite all the darkness. And when you have lost hope, you've lost everything. But when you've lost everything, there's still hope. I think that is amazing. I certainly ask people a lot about hope, because hopelessness can be certainly a major sign of depression in people. And it may put people at risk for more likely doing something to harm or in their life. I had a patient one time, and again, hope has to be reinvented, re-looked at, reevaluated throughout one's cancer journey. I had a patient once, they asked me to see, and he was a man in his 60s who had pancreatic cancer. And he had gone through, I think it was the two levels of treatment. And the first level failed him. The second level failed him. He was on third line treatment. And I went to see him while he was getting chemotherapy. And I said, well, what are your hopes? And he said, I don't have any. I said, you have no hope. He said, no. And I said, well, help me understand why you're sitting here in a cancer center with an IV and getting chemotherapy if you absolutely have no hope. Well, he laughed and he said, well, maybe I've got more hope than I think I did. We were able to talk about other things. Well, then what hope? And he talked about how the fact that he was going to Disney with his grandchildren and his family in a week. And he was really hoping they were going to have a good time. And then he began to see hope in a different way. It wasn't just around the fact that whether he would live or die from his cancer, but there was hope in life in lots of ways. And he was able to redefine that. And people will find that you may have to redefine hope throughout your journey. Humor and laughter, there cannot be anything better than finding time to just enjoy things, watching fun movies, interacting with a friend. It gives you a break from living with the difficulties, the uncertainty. I have a patient who shared recently that every night she has a friend from childhood who now is also going through cancer. And every night they send themselves a text, the last thing they do. And it's about joy. It's about fun things. It's a way for them to connect in a way every single day to remind themselves that life is more than just the difficulties. And I just want to share a couple funny comics that I found on a website, a couple of websites about sort of cancer humor. And again, nurse, with this chemo cocktail, can I get some mixed nuts and pretzels? Or, hey, I don't understand why you don't want to take your daily medication when you've got 15 different medications. So I hope some of those ideas about ways to sort of look at life, live life, engage in life can help maybe with the uncertainty. When to seek help, though, if you are finding that you are consistently most days down, there's a loss of pleasure or interest, you're not, and it's lasted for at least 2 weeks, it's every day, or your anxiety and worry are really consuming you, you are not managing it, it's managing you, please reach out for help. And there's help in lots of ways. If you have any thoughts of ever harming yourself or ending your life, please seek help immediately. You can call 911. There is a new National Suicide and Crisis Hotline at 988, or you can go to your nurse emergency room. And I just want to say thank you so much. And I have to tell you, I'm very I'm not good at anything technological. So for me to have a slide that actually moves is pretty good. So thank you all so much. And I'm looking forward to being part of the panel.
Thank you, Laura. We also welcome Wayman Scott and Dr. Jessica Engle to join you for a time of Q&A. Please submit your questions through the Q&A button at the bottom of the screen, and we will do our best to address them. Several questions for our speakers have already come in, so let me start with this one. This is specifically for Dr. Engle. How would someone go about making an appointment for the cancer rehab? Does this require a referral from the oncologist?
It's a good question and an easy one to answer. Ideally, we have a referral, but it's not 100% required. So if you can get a referral, that would be great. You don't have to have a referral. Our number that can work for the DC, Bethesda, or Baltimore campus is 443-997-5476.
Thank you.
Thanks.
Another question that we've had asked a few times is if this webinar will be available later on, and we will post the video and share the link with participants, and it'll be posted on the Sidney Kimmel Comprehensive Cancer Center website. Another question is it normal to feel hopeless and hopeful at the same time?
Wayman, do you want to touch on that at all?
Well, it's natural to go through a range of emotions, right? There's going to be some days when you're going to access your hope better than on other days. It's almost as if sometimes the normal is that there is not a normal, right? And sometimes it's just day by day. It's unique to the individual.
I think, again, from my standpoint as a psychiatric nurse, I think it is, feelings are feelings, right? And there are times when we have feelings that are not the most pleasant of feelings, right? So it wouldn't be uncommon for sometimes to actually feel like maybe there is no hope or whatever. Again, where I become concerned is if that becomes a persistent feeling. So if it's occasionally people have feelings that are more negative or people are worried about, again, looking at the situation and stuff, but if it's a persistent feeling where you feel that most of the time, most every day, you're trying ways to feel differently and it's not working, then I would definitely ask to get some help. I would, because hopelessness, like I said before, can be a sign of depression. And certainly depressions are very treatable, and getting help can be pretty easy when you really need it.
Thank you. As a caregiver, how can I best support my loved one when they're experiencing anxiety?
I think being just available to talk with people about, I think, Dr. Engle brought up a lot of stuff around fatigue and stuff, but, when dealing with anxiety, a lot of times, and that's the number one thing I deal with. I deal with helping people with their anxiety probably more than anything. What I find is that the first thing I want to know is, as she mentioned around fatigue, is the same, is to really take a look at everything that someone's doing. Because sometimes there are medications that will actually cause people to feel more anxious or whatever. I think talking about things, finding if there's things that help people to feel less anxious can be really helpful. Sometimes I've heard people say, I don't want to tell my loved ones that I'm feeling that way because I don't want to make it harder on them, when actually caregivers will tell me that the not knowing what's going on makes it harder. So just talking about it, again, it's a feeling. And there are so many things that we can do. Exercise, as Dr. Engle said, the meditation, getting someone, helping them to be in the moment, and meditation and the breathing and stuff can be so helpful. I think, just trying to really understand what's causing what they're anxious about, and then looking at ways to help them with that is really important. And I'm open to anything else you guys also have thoughts about.
I thought that you described that, very well. If we see a loved one, someone that we're supporting, one that we, want to be able to move through life and spend time with day-to-day struggle, we're going to want to be present. And I'd say from a spiritual care or chaplaincy perspective, it's often about being with them in that moment. Right? How can you be present? I think sometimes people might need support, and yes, there's times when other clinical interventions might be due. But sometimes people are asking for help, and they're asking just to be heard and somebody to walk with them and just bear witness to what they're experiencing. But Laura, I think you put it very well in your previous answer. There's really a scale. Is it something that's affecting your ability to function? Is it every day? Is it chronic? Is it impacting your daily life? Is it preventing you from accessing your joy? So if the answer is yes to some of those questions, then yes, a broader intervention could be needed. But if it's something more in the moment, then just that presence of somebody that you love and care about and trust can go a long way.
Yeah, I think oftentimes we want to do something, and that we do what you just said is so important, that presence, just knowing that you being there for them, being present with them, and will sit with them in their anxiety, their distress, can mean so much. Often people are worried about, well, what should I say? Sometimes, a lot of times, if people are anxious or distressed, they don't even remember what you say. They just remember that you're there. Also, as a caregiver, please take care of yourselves. It's really hard to take care of your loved one if you're not taking care of yourself. And we know by studies that oftentimes the stress, the caregiver is actually higher in some ways than it is for people that are actually the patient. So, or the person going through the cancer. So please, please take care of yourselves.
Yeah, I would add too that I went to a conference recently and someone put it so eloquently. When you're having trouble doing stuff, that's when you need help, stuff. And that can mean going to work. That can mean doing things that you loved before. Whenever you're having trouble doing any sort of stuff, that's when you need help. And that could be emotional help, spiritual help, psychological help, physical help, and it can mean so many different things. And I think a lot of times too, we underestimate the power of touch. And sometimes you might not know what to do, but just, touching a loved one on the shoulder or holding their hand can be so powerful in the moment.
I agree. Physical touch is huge. We've got questions pouring in, so thank you for your responses. Dr. Engle, any suggestions or strategies for falling asleep? This person said that once they're asleep, they stay asleep. It's just the falling asleep part that's hard.
Yeah, so sometimes mindfulness journaling can be very helpful. Sometimes there's so many different things that can help. Mindfulness journaling, I've even had some patients that said they were doing the adult coloring books because it was so different from what they were dealing with in their life that they could take that time and know that was their time to relax to do this coloring book for 15 minutes. Sometimes meditation. I've had patients that have practiced Reiki or used different techniques that they've gained from different types of meditation as well. But also, making sure it's dark in the room, making sure it's, either quiet in the room or you have some sort of relaxing noise machine, or sometimes people will use, and I know there's a whole lot of issues about that, but some people will use some aromatherapy or something along those lines. Sometimes even just applying lotion before you go to bed can help, even with like neuropathy and restless leg symptoms. So just trying to get into a routine can be very, very helpful. And also trying to do exercise earlier in the day can make you more tired and help you fall asleep.
Great suggestions. Thank you. After this person said, after my craniotomy, I cried and it still hurts and embarrasses me. How do I adapt to this? I went from a strong man to a guy that cries out of nowhere for no reason.
Jessica, you have any thoughts?
Yeah, so that's not uncommon, because basically after you have a craniotomy, you're exposing brain that to air, and that completely changes the environment in the brain. It's almost like a traumatic brain injury, right? It's something that's needed, but there is a surgery that occurs. And so there's a lot of things that can happen. And I think it's great that you recognize this, and I really admire your courage for bringing this to the table. It is something that we can address with different medications, with different counseling as well. It's not uncommon. And we'd have to delve into it a little bit more to get a few more details, I think, but it's not uncommon at all, especially depending on what area of the brain required treatment or what area you might have a tumor as well. So I think.
Go ahead, I'm sorry.
So Laura has a lot of great suggestions as well. And
well, I just know that sometimes even the medications they put you on, like there's some seizure medicines that actually make people, or if you're on steroids, after a lot of times people, if they're on steroids, it causes a lot of lability of their mood, and crying becomes much more common. But even the antics, if you're on any kind of seizure medicine, talk with your doctor. There are certain medicines that can make it more difficult and have more change in people's behaviors, their feelings, their emotions, and making a change in that medicine alone could really make a big difference.
mm-hmm.
So I would definitely talk with your docs about that.
Yeah, that's very true. A lot of medications can affect a lot of things, including libido as well.
Good point. What were the 3 Ps that were discussed in the presentation? Planning, prioritizing, and the third
Let's see. So the 3 Ps, let me go back so I say the exact right thing and I don't make my own version of it. Let's see, maybe I can even bring up the slide. Can we go back to that so I can bring up the slide? Is that okay?
Yeah, oh yeah, so you can come back to it, sorry.
Okay, thanks.
I thought we were trying to pull up the slide. So another question is stress that making plans resonated with me because I have metastatic breast cancer. My work wants me to plan ahead, and my husband sometimes brings up dreams that make me feel guilty, stuck, demoralized, depressed because of all the uncertainty. Sometimes staying present isn't enough. How do I reclaim my ability to make plans?
I'm sorry, Chelsea, can you read that just again, just the part about the work and all that sort of thing?
But work wants me to plan ahead, and my husband sometimes brings up dreams that make me feel guilty, stuck, demoralized, depressed because of the uncertainty. Sometimes staying present isn't enough. How do I reclaim my ability to make plans?
Yeah, well, one of the things I think I talked about a little bit was, trying to focus more on short term. I mean, I know that people, and I say to people, of course you want to plan for things in the future, but also with the uncertainty, having more short-term things, saying to work, to people, well, let's plan for the next month, 2 months, and then see where things are, reevaluate, because you might be able to. I'll give you an example. I had a patient recently whose daughter went to college in Scotland, and he was getting treated. He's actively getting treated for cancer, and he said, I'm not going to be able to go to that graduation. I just am not going to be able to go. I didn't feel well or whatever. And actually, as they got closer to the graduation time, he was doing so much better than anyone had thought that he was actually able to plan and go to the graduation and actually go to Scotland and go to graduation. So I think in some ways of keeping it realistic, short term, and then being able to make those adjustments as you do. I think it's always okay to dream big, to say, well, maybe in 5 years we'll do this. But again, staying focused on, but let's, we're not going to wait for those kind of things. Maybe are there other things that we can do that might be that we really want to do, that would be meaningful, that maybe would be part of this dream? I don't know. I think that oftentimes that's what I've seen people find to be very helpful when they're dealing with those situations. And I think being honest and talking about, how that makes you feel, like, listen, I'd like to plan for this too, but and let's think about it. Let's keep that as a hope. But also let's live it now and enjoy things and that sort of thing now. I hope that's helpful.
Thank you, Laura. I know we're running out of time, but I wanted to ask one more question about the difference between hope and joy.
Hope and joy. Well, the idea of accessing joy, even if you have with a cancer diagnosis, be it something new, maybe something that has returned, are you still able to access those points of joy in your life? What is holding you back from being able to enjoy time with your loved one or enjoy things that you often have? And then hope, just to piggyback off of what Laura was sharing, what can you do in the moment? What can you can hope to maybe attend that graduation or that wedding, but having some openness for adjustments maybe makes room for that hope to be a little bit more realistic.
Laura, do you have thoughts about hope and joy?
I don't know. I'd have to think about that one a little bit.
That's fair.
Jessica, do you have any thoughts?
think it's so hard for me to put a line in the sand between them because there's emotions mean so many different things to different people. So I think whatever I say is going to be my projection of those emotions.
Yeah.
I should have qualified that before my statement. My statement was exactly.
I think we actually have a couple more minutes before we wrap up.
I can share the slide real quick if that's okay.
Yeah, please.
So it was, I think you can probably see it now, planning, prioritizing, and pacing. I just didn't want to say the wrong word. So it was planning, prioritizing, and pacing. And we've learned a lot about pacing, even more so recently with the post-COVID long haul community as well. And how, not to overdo it because you can really pay for it in the next couple of days, unless it's something very meaningful to you, like a big life event or something like that. But the pacing is very important, and to kind of put forth things that are more important in the forefront and prioritize as well. But pacing is really important so that you don't, try to run at 1,000,000 miles an hour 5 days in a row. And if you have to run at 1,000,000 miles an hour because you're doing a major life event, that you do that for a short period of time, and realize you're going to have to pace yourself and have to organize things. And so that's what that slide was about.
And Dr. Engle, did you have any suggestions for folks that are having trouble with waking up in the middle of the night and staying awake?
Yeah, so that can also be helped with exercise as well. And it also, we have to look at what's waking you up in the middle of the night too. Is it something that, are you getting up in the middle of the night to urinate? Are you getting up in the middle of the night because you're in pain? Are you having hot flashes that are waking you up in the middle of the night? And these are all things that we can look at and kind of get some more information about. There's some lifestyle changes as well as perhaps different therapies that could be used and maybe even medications. I've learned a lot about hot flashes and some very fancy different things you can use and some things that are not so fancy. Like some people wear athletic wear to bed. They're supposed to wick the sweat away and keeps people cool, so they'll wear athletic wear to bed, and things like that I would have never thought of. So patients are wonderful and they provide such wonderful resources, and I learn way more from them many times than I think they learn from me. So I'm happy to hear any other suggestions as well, but there are a lot of different things that can wake us up in the middle of the night, and we have to kind of look into that and figure it out a little bit more in person or virtually.
Well, I certainly hear a lot about sleep problems, and we are notorious in oncology for many reasons to really encourage people to drink lots of fluids. And then I had a patient one time who said, "Laura, I'm getting up, I can't sleep." I said, "Well, tell me about it." And he said, "I'm upset 6 times a night going to the bathroom because y'all told me to drink. And so we talked about how don't drink a lot after like 5 p.m.
Mm-hmm.
Drink a lot during the day and then sip so that you're not. And because he's like, "I think I need some medication or something." I said, "No, I think you need to stop drinking so much." And so he did, and he said, "Next time I saw him, he said, I get up once a night and I go right back to sleep now." So again, too much of a good thing sometimes isn't the most helpful either.
I don't know if we have time for one more question, but how would folks figure out what is triggering their anxiety?
Wow. I think it would be good, one of the things, like I know I mentioned cognitive behavioral therapy before, and one of the things that cognitive behavioral therapy does is to have people, when they start to experience anxiety, is to sort of really look and sort of keep even maybe a record of it, to see if they start to feel like there are certain situations or things. My patients sometimes, like I said, can be on medication. So what I'll do is I'll say to them, pay attention to when you start to feel anxious. And what's the situation? What are the feelings? What are your thoughts? And then to see if there's some kind of sort of pattern to it that they might be able to pick up on, so that they might be able to be very proactive and maybe managing that or whatever, or becoming aware if it might be potentially a medication side effect or something like that. But that might be sort of to begin to be helpful. Get some feedback from people. Hey, if you notice when I'm anxious or whatever, that might be helpful to start to understand what their anxiety is about.
Thank you for your questions, everyone.
Great. Thank you all, Laura, Wayman, and Dr. Engle, for your generous gift of your time and wisdom this afternoon. We trust that you have shared such important insights with our survivors, their caregivers, and friends. At this time, we just want to remind you that it's open enrollment time for both Medicare and the Maryland Health Connection or Maryland Marketplace. So here is information. It only happens once a year. So Medicare's open enrollment has started, and we'll go through December 7th. Patients with Medicare can change their Medicare plans at this time. The Maryland Health Connection open enrollment period is starting soon, November 1st through January 15th. For private health plans and Maryland medical assistance. Again, we are here to help with the patient and family service program. So please reach out to connect with your oncology social worker if you need more information or support. We also have tables set up Tuesdays, Wednesdays, and Thursdays midday in Weinberg and Vera lobbies if you're here for any kind of follow-up appointment. Again, lastly, I guess just our last slide is just again a reminder of reaching out to the Harry J. Duffy Patient Family Service Program for any of your practical, emotional, and spiritual support needs. Again, we so appreciate all of you joining us for our 10th annual survivorship program or webinar, and we hope that you'll be able to join us again in the future. We will be, as you know, we've recorded this program, and we will be sending attendees a follow-up email with the link to the recording, slides of the speakers, and we'll certainly get this up on our website as soon as we're able. So again, thank you so much, and have a great rest of the day. Bye.
Very well.